Welcome back. Now, the National Institute for Communicable Diseases has reported 227 lab-confirmed cases of measles between Limpopo and Mpumalanga. Unicef South Africa warns that the measles outbreak threatens the health of children across the country. Now, Northwest, Mpumalanga, Limpopo and Gauteng are all affected by this outbreak, and it is vital for children to be vaccinated. For more on this, we are joined by Muriel Mafico from the Unicef South Africa's Deputy Representative. Thank you so much for joining us this evening, Muriel. Now, measles in these regions, such as Limpopo and Mpumalanga, has been dubbed an outbreak. What constitutes an outbreak and how dire is the situation?
So, first of all, thank you very much for setting aside time to have this discussion on the measles outbreak. A measles outbreak typically is defined as a situation when you have at least 3 cases in a district within a month. That already constitutes and actually warrants the declaration of a response and the declaration of the need to then take remedial measures. So that is the situation where we are in. In fact, with all the holiday travels that are happening, the numbers of provinces that are affected are likely to increase. There is actually information at hand that the number might have increased from the 4 provinces that we were talking about. So that is why it's very, very important that we continue to communicate with families, with caregivers, with all the communities, to actively play their role in making sure that all children are protected, all children are vaccinated against measles, but against other communicable diseases as well. It's very important that parents ensure that their children are fully protected.
Most certainly. We are seeing that the numbers, like you're saying, during the holiday travel are increasing, but the numbers that are specifically increasing are of Limpopo and Mpumalanga, which are both border provinces. Does that have any impact or reason as to why the numbers specifically in those provinces? Because we know that Limpopo is sitting with 110 cases, while Mpumalanga is sitting with 64, whereas Gauteng and the Free State are sitting with about 10 and 5 respectively. Is there a correlation with these being border provinces with the increase in these numbers?
We have seen a number of countries actually in the region that have had different waves of measles outbreaks. So it is not surprising that with the mobility of people crossing borders, visiting their families, traveling, just regular travel, it is likely that you will get cases along border provinces. But this is not unique to border provinces. I just mentioned that we have other provinces that do not necessarily share a border with other countries, and yet they are also affected. Measles is a highly contagious disease. It is highly contagious. It is also deadly, particularly in children that have not been vaccinated. So it is important that, again, we take the importance of vaccination seriously. It is critical that we don't only focus on measles, but indeed look at the entire vaccination schedule that children are supposed to go through. And this is clearly outlined in the Road to Health booklet that children should be having once they start their vaccinations at birth.
So, Muriel, you mentioned how deadly measles are. Just take us through the symptoms that a parent then should be wary of, or anyone that should be wary of in seeing that this could be measles.
There are several symptoms that parents can look out for. Some of the typical symptoms that people often cite include high fever. They include runny nose, as well as maybe red, blotchy skin. But I think we don't need to hazard guess. We don't need to. And that is why checking the Road to Health card, parents will know which vaccines their children have had. And if they are in doubt, it's important to go to their nearest health facility and consult. So that is what we are urging parents to do, to check the Road to Health booklet, make sure that their children are up to date with all the vaccines that they are supposed to have. And if they are lagging behind, take them to the clinic. Immunization is free. The services are there. So it's important that parents prioritize this. And in fact, it is the best gift that parents can give to children, making sure that they are fully protected and therefore can grow up healthy and they can thrive.
We're speaking primarily of children here, Muriel. Are we saying that adults are not prone to measles?
If we look at because once you've had your vaccination, you should be protected. What we are seeing right now with the cases that have come up and they are confirmed, we are seeing the predominant number of cases for children who are between the ages of 5 and 9. It's about 44% around that age group. Of course, these numbers continue to change as we get more figures coming through. And then you also have a number about close to 28% who are between the ages of 1 and 5. And 4, sorry. So those are the age categories where we are seeing the bulk of the cases that have been confirmed so far.
I mean, you've been stressing a lot that parents need to vaccinate their children, and we know that at the height of COVID, parents were reluctant to go to healthcare centers, but that simply meant that a lot of children are now not fully vaccinated. They didn't get two of those shots. What impact would this have on these children, and moreover on the possibility of herd immunity?
If we start at the global level, we are seeing that almost 25 million children have missed out on life-saving vaccines. That is a huge number by any standard. Coming to South Africa, we recently did an analysis to support the Department of Health. In fact, it was done jointly. And in that analysis, it was found that almost 100,000 children in South Africa have not been vaccinated, and therefore they are not protected from some of these vaccine preventable diseases. So this is the target group we need to worry about, the children who have not been vaccinated and therefore are more susceptible, they are more vulnerable, and they are actually at very high risk.
So, Muriel, when a child has then been diagnosed with measles, what's the process thereafter? What treatment do they take? Should they be isolated from the rest of the family? What sort of precautions should people take once a member of the family has measles?
I would leave that question to medical doctors so that we do not confuse the public.
Right.
My refrain is that it is important for parents, if they suspect that their child has measles, to consult professionals. Consult the nurses, the doctors at their local clinic. In terms of the disease itself, I mentioned earlier that it is highly contagious. And that is why we are urging communities to really make sure that they check the Road to Health card, they take their children for immunization, and if in doubt, they make sure that they take them to the clinic for professional support. And it's important that we respect the medical field. And on this note, I think I just want to highlight also that from UNICEF's side, we are supporting the national response. We are supporting in terms of even procurement of equipment which is used to store vaccines. We feel that this is really an important area which will contribute to strengthening the health system, especially after the impact that we saw during COVID and the overstretching of the resources that are in the health sector. We are also investing in supporting the Department of Health to equip health workers because they are the frontline workers working on a day-to-day basis in dealing with not only measles but a range of other health challenges that the country is experiencing. So we are supporting the training of health workers to make sure that they are fully equipped to deal with this national issue that has just come up, the measles outbreak.
All right. Thank you so much for your time and for that update, Muriel. That was Muriel Mafico, the Unicef South Africa Deputy Representative, speaking to us there about the outbreak of measles in 4 provinces within South Africa and the emphasis there being on parents to ensure that children have been vaccinated.